Hello, I'm Dr. Niskoda. Welcome back to AZH Wound Center in Milwaukee, Wisconsin. Another interesting patient to show you, and we're going to, again, highlight some very cool cutting-edge technology. This is a patient that came to the clinic today for initial consultation. As you'll see, he's got a little trauma to his left volar forearm. Now, I've already cleaned this up, and we had a lot of necrotic debris across the wound. You can see I've taken some of that off, cleaned that up. He actually had an avulsion injury here where this tissue was rolled under, and the epidermal surface was actually down against the subdermal tissues, creating sort of a ledge that would have never healed. So I have actually unfurled that, placed it back down. This injury is now about a week old. And so I'm not sure that this is going to survive, but we're going to give it a go anyhow. So I've cleansed the wound. He has been soaking with hypochlorous acid now for about 20 minutes. As you know, hypochlorous acid is very good as an antimicrobial. So we've cleansed the wound. You can see there's some islets of epithelialization already starting here. These are originating from the hair follicles, as we know. And we're hoping to get a nice salvage here. One of my tricks in managing skin tears is to use collagen-based products with a semi-occlusive dressing, and we're going to show you that application today. First of all, what I'm going to do is put down some Prisma. As we know, Prisma is a very rich collagen dressing that has a silver component that's good for antimicrobial techniques. And we will cover the wound. Cut some strips here. And just cover the areas of exposed tissue with the Prisma. There we go. Good. So the rich collagen will interface with the wound surface. Now we're going to cover it with a new technology. We've actually demonstrated this before, but I think this is going to provide an excellent secondary dressing for this type of injury. It's called OxyBand. It's an oxygenated wound dressing. This dressing is packaged in such a fashion as to have a reservoir filled with 100% oxygen. So this reservoir here with this little buff puff is filled with 100% oxygen. Now I've activated the dressing, having taken it out of the packaging, and now oxygen is flowing from these pores. And what we're going to do is we're going to take this off. This is a Tegaderm type of dressing with an adherent side that'll go down towards the wound. There you see our activated oxygen reservoir. I'm going to go ahead and apply this over the wound. And what I like to do is apply it in such a fashion, so we're going to do it in such a way that I cover as much of the wound as possible. I like to walk the dressing down from one side to another. So here you see I'm securing the dressing. It's very important to have an occlusive dressing with the OxyBand. Pop that down here, and we will walk it all the way around, securing those margins. The oxygen is flowing from the reservoir. It does not penetrate this surface here. This is impermeable to gas, but the undersurface, again, the wound surface is permeable to oxygen, and oxygen is now being delivered to the wound itself in a continuous fashion. We leave these OxyBand dressings on for 5 to 7 days, and then the patient comes back for follow-up. We'll bring him back on Tuesday, and this gentleman has been kind enough to allow us to film today. We're going to film his follow-up visit next week, and we're going to demonstrate the healing we get. Beauty of these dressings, again, we're getting 100% oxygen delivered to the tissues, which is certainly helpful in wound healing. We have provided a very nice controlled environment with our collagen interface on the wound. The wound is trying to lay out collagen right now. We're going to stimulate that. Again, the beauty of the Prisma is that it does have the silver to prevent, hopefully prevent infection. and decrease bacterial contamination, thus speeding the healing as well. So here you see an application of OxyBand over a skin tear. I think this really changes the way we manage these wounds. If you think about it from a cost standpoint, instead of changing this dressing once a day, which is probably associated with $30 to $40 worth of labor costs, in addition to the other dressing material, and you go to a 5-day dressing, we've become very, very cost effective. The OxyBand dressing versus probably $200 to $300 worth of expenses on daily changes. So I hope you've enjoyed this edition of the Wound Care Window. Stay tuned for the follow-up visit. We're going to put these all together.